Hi everyone, my name is Aubrey Hausig, and my occupation-based kit is called the Handy Hobby Box. This was based on a client. His name is SN, and he is 70 years old. He was admitted into inpatient rehabilitation following a right hip fracture, but he also presented with osteoarthritis in his right hand. So although the OT focused on improving his weight-bearing status into his right lower extremity, they also focused a lot on fine motor tasks. So that became the basis of this occupation-based kit. The client stated that he absolutely loved woodworking. He used to make different birdhouses and help out with various projects around the house. So he also said that he wanted to be able to teach his grandchildren how to woodwork. So that became a primary goal for him, was to improve his fine motor coordination, dexterity, and overall just hand use, grip strength, pinch strength, all that fun stuff, to hopefully improve his ability to woodwork and complete various fine motor tasks.
So over here we have lots of different boards that all require different fine motor skills. So like this one, you have to lace in between each of the eyes to make a pattern. There's some clips as well. There's different locks, and then you have to twist different nuts onto the bolts. All right, and with this board, there's different zippers, different hooks, latches. You can practice shoe tying, and then here you can practice plugging different objects in, which you'll see in the demonstration. And then this one, there's different screws, so you can screw into these 4 holes, and then you can also twist different nuts onto here. And then there's a blank one as well, because my fieldwork educator is a handyman himself, so he can make a custom board for his future clients. And there's 3 different levels, but they can also do this activity on a table, or you can make it harder by going at different levels. So I'll start in the middle level for this person. And whenever you're ready with this one, you're going to thread it through each of the little eyes to make a pattern.
The specific goal for SN that was the focus of my kit states that SN will improve his right hand tripod pinch strength to 15 pounds so that he can button a shirt independently while seated at the edge of his bed within 2 weeks. As you can see, each of these boards with their respective activities require varying levels of pinch and grip strength, so it's an excellent activity that focuses on what SN loves to do while helping him achieve this goal. Improving his pinch strength and overall use of his right hand will increase SN's independence in important daily tasks that he previously struggled to do with his right hand, like taking off the cap of his toothpaste, using a key, or opening small containers. When I implemented this kit with SN, he really liked the nuts and bolts activity and enjoyed trying to figure out the most efficient way to lace the string through the metal eyes. He actually suggested how I could modify this kit. For the lacing activity, I originally used a shoestring, but SN mentioned to me that this would be difficult to clean and it would wear out pretty quickly, so he recommended that I change the shoestring out for a piece of leather lace, which would be much more durable and would be easier to clean. Other than that, there were no other modifications that I made to this kit. Current literature from higher level studies supports the use of fine motor exercises to improve manual dexterity for individuals with hand osteoarthritis. Evidence indicates that these exercises can improve grip strength, pinch strength, digit range of motion, and overall hand function. Based on the evidence, it can be inferred that this activity, which focuses on various functional fine motor tasks, can be an effective treatment to improve manual dexterity for a patient like SN with hand osteoarthritis. This occupation-based kit is a justifiable service because it takes a skilled therapist to be able to see a client's current level of functioning and figure out which activities on the boards would provide the just right challenge for a client. The therapist must have the background knowledge of proper body mechanics when completing these activities so that they can provide education and opportunities for optimal improvements in fine motor skills. It takes an experienced therapist to observe their clients for signs of fatigue and provide recommendations to modify the task based on the client's current ability. A therapist can also use their knowledge and experience to grade this activity up or down to focus on other aspects, like other functional prehension patterns or crossing midline. As you can see, this is a skilled, justifiable service because it takes a well-trained therapist to safely and successfully implement this kit to maximize a client's functional outcomes.
Handy Hobby Box. Therapist tested.
Client approved.